The heart, a tireless worker, beats constantly, pumping life-sustaining blood throughout our system. How do we monitor this vital organ? Enter the electrocardiogram, or ECG, a tool that provides a window into the heart's electrical activity. The ECG captures these impulses as waveforms, allowing doctors to visualize the heart's rhythm. Imagine the ECG as a heartbeat detective, analyzing each signal to uncover clues about the heart's health. This guide will explain the key elements of an ECG and their significance. Whether you're a medical student or a curious patient, this guide will help you understand this essential diagnostic tool. The ECG is a painless procedure, performed by attaching electrodes to the patient's chest, arms, and legs. These electrodes detect the heart's electrical signals, which are then recorded on graph paper or displayed on a monitor. By analyzing these waves, doctors can evaluate the heart's rhythm and detect signs of heart disease. Join us to demystify the ECG and appreciate this remarkable tool that helps keep our hearts healthy. Our journey into the heart's electrical symphony begins with the P wave, a small, rounded bump at the beginning of each cardiac cycle. This unassuming wave represents the electrical activation of the atria, the heart's two upper chambers responsible for collecting blood returning from the body and lungs. Imagine the P wave as the conductor's baton rising, signaling the start of the orchestra's performance. As the electrical impulse spreads through the atria, it triggers the contraction of these chambers, propelling blood into the ventricles, the heart's two lower pumping chambers. The P wave, therefore, reflects the initiation of the heartbeat, marking the moment when the heart prepares to receive and pump blood. A normal P wave is smooth and rounded, indicating that the electrical impulse is traveling smoothly through the atria. However, abnormalities in the P wave's shape, size, or duration can provide valuable clues about potential problems with atrial function. For instance, a P wave that is too tall or too wide may suggest an enlargement of the atria, often associated with high blood pressure or valve disease. On the other hand, the absence of a P wave could indicate a problem with the sinoatrial, or SA node, the heart's natural pacemaker, which initiates the electrical impulse. By carefully analyzing the P wave, doctors can gain insights into the health of the atria and identify potential issues that may require further investigation. This seemingly small wave plays a crucial role in the ECG's ability to diagnose and monitor heart conditions, emphasizing the importance of paying close attention to even the subtlest details in the heart's electrical language. In the next section, we will explore the PR interval, which bridges the electrical activity between the atria and ventricles. The QT interval represents the total time for the ventricles to contract and then recharge. It's measured from the start of the Q wave to the end of the T wave. A prolonged QT interval can indicate an increased risk of ventricular arrhythmias, which can be life-threatening. Monitoring the QT interval is crucial in assessing the effects of certain medications and electrolyte imbalances on the heart. The ST segment is the flat, isoelectric section of the ECG between the end of the S wave and the start of the T wave. It represents the period when the ventricles are depolarized and in the early phase of repolarization. Any elevation or depression in the ST segment can be a sign of ischemia or myocardial infarction. It's vital to pay attention to changes in the ST segment for timely diagnosis and treatment. The T wave reflects the repolarization or relaxation of the ventricles. It follows the ST segment and is usually upright in most leads. Abnormalities in the T wave, such as inversion or peaking, can indicate various cardiac conditions, including ischemia, electrolyte disturbances, or the effects of medications. Observing the T wave helps in understanding the overall health and function of the heart. An ECG or electrocardiogram provides a comprehensive view of the heart's electrical activity. By analyzing the different components, such as the P wave, QRS complex, QT interval, ST segment, and T wave, healthcare professionals can diagnose and monitor a wide range of cardiac conditions. Regular ECG checkups are essential for maintaining heart health and preventing serious complications.